Hello, my name is Heather Butts, and this session is going to be on ethics during COVID 19. First, a little bit about me. So, I received my bachelor's degree from Princeton University, my law degree from St. John's University School of Law, my public health degree from Harvard University, and my master's degree from Teachers College at Columbia University. I'm currently a public health law professor and nonprofit professional. So, Verge, what is COVID 19? COVID 19 is also known as coronavirus. It's a respiratory illness and it spreads from one person to another. This virus was first identified in Wuhan, China. COVID 19 is called COVID because the CO stands for corona, the VI for United States. I think unfortunately we all know the answer to this at this point is yes. The first case was identified on January 21st, 2020. The World Health Organization has a website that updates us on COVID-19 rates. You can see that at www.who.int. How does COVID-19 spread? So the thought is that COVID-19 originated in animals. However, we now know that it definitively can spread from person to person. What we also know is that it spreads from person to person through respiratory droplets when a person sneezes or coughs, and it also spreads by virtue of people being in close contact with each other, touching a surface, an object, the virus on it, and touching one's mouth can also infect an individual. However, the main spread of the disease is thought to be person-to-person contact through droplets as described above. What are symptoms of COVID-19? Fever, cough, shortness of breath. Other symptoms described on the CDC website, which is indicated here. It can include headaches, so forth. How can individuals protect themselves and others? The best way your face with unwashed hands, clean objects and surfaces that you have contact with. And if you are sick, you should stay home. Also, covering your nose and mouth when you sneeze or you cough is a good way to protect others. Quarantine versus isolation. This may be a term that you've heard, a little definition to it. So, quarantine means restricting movement of people exposed to a contagious disease. So, this is if you've been exposed to somebody with COVID-19 in one of the ways we described earlier, a quarantine would mean restricting your movements with respect to being exposed. But a quarantine doesn't necessarily mean that you have the disease. In fact, it means that you are not exhibiting signs of the disease at that point. Isolation is keeping a patient known to have COVID-19 separated from other people. So when you are in isolation, you are separated from other people. You have the disease, you are exhibiting symptoms, and you are kept away from other people who do not have the disease. Issues. So the second part of our discussion is going to talk a little bit about what the government can and cannot do, what society expects, and how we can live in society over the next few weeks and months, given what's going on with COVID-19. But first, what is a public health emergency? Well, to describe that, we first have to describe what public health is. So, public health has to do with health and medical issues that impact all of us as a society. When we get into the realm of a public health emergency, that gets into, is there something that puts others as well as ourselves in immediate danger? And if there is, how can we protect other people? The good of the many versus the good of the few is what we think about when we talk about something called the utilitarian model. So public health really strives to look at how we can protect other people from getting sick. And if we are the source of the sickness, how we can make sure that we don't get other people sick and we protect ourselves. Compulsory powers. And this comes from a wonderful article that I've cited below that was just released about a month ago. Individuals must the least restrictive means must be used to achieve public health objectives. Assessments must be based on best available scientific evidence. And use of coercion should be proportionate to the risk. So this talks about, can people be compelled to safeguard others? And the answer is yes. Hopefully, though, that is when people want to safeguard themselves and others through the means that we described earlier. Emergency powers that the state can institute. So what can the government actually do? This is probably a question for a lot of people in light of things that are being canceled and so forth. And you might have friends or relatives that say, oh, well, I don't care. I'm still going to go on and live my life and do my thing. Well, that's not exactly the way it works. So the government has a lot of power to do lots of different things. Travel warnings, we call them non-essential personnel, suspending flights, quarantines, we described before, evacuations. These are all things that the government can institute. And oftentimes it's the state government that does this. So if you're in a particular state, you probably noticed that you've seen local officials are the ones charged with such work as protecting us. Can the government tell me to stay home, not go to basketball game, stop me from getting on the subway? The short answer is yes. And why should we care? We should care because the public health is not just about our own health, but about the health of all of us. We protect ourselves by protecting others, we protect others by protecting ourselves. Federal powers and the health of the public. So the federal government has powers as well. This is Congress, this is the president, the Supreme Court, they have powers as well. And I'm not going to get into too much detail because this gets a little legalistic, but basically the federal government has the right to control things that involve lots of states or protecting people at an international level. They also are able to protect people when it comes to things like taxing and spending powers. The Affordable Care Act is an example of how the federal government protects our public health. And that law was enacted to protect people in lots of different ways. We normally think about it in terms of protecting people and ensuring that they have healthcare insurance, but there's lots of ways that the Affordable Care Act protects people. Civil liberties and the right of privacy. So Jacobson v. Massachusetts is a case, and it goes to the notion of state being able to say, we need you to do certain things in order to protect yourself and also to protect other people. Vaccinations are a very good example of that, and that's what the Jacobson case is about. In the case of coronavirus, there will be times when, in the future, the state, your state, the government, will require people to do certain things, and you may wonder why, and that is because it's safeguarding all of us. This is called something called police power. States and localities have the ability to protect you, and it's a power promoting the public welfare by restraining and regulating the use of liberty and property. The states cannot exercise powers relinquished to the federal government and specified in the Constitution. The states cannot infringe on the rights of individuals to the extent those rights are protected by the Constitution. State interest in public health. Why do states care? Because they want to protect others from external dangers. They want to advance the overall interest of the state and protect people from sometimes their own poor decisions. That is the end of this session. If you have questions, feel free to email me at hnbutts@aol.com on this time. Thank you.